for joining the inaugural LCHR conference. I am Dr. Leah Raby, Executive Director of the Louisiana Commission on Human Rights, and I want to extend a welcome to the Next Normal, an event designed to convene our partners for the important conversations despite our inability to meet in person. We have collectively lived through one of the most defining moments in our recent global memory. The COVID 19 pandemic has challenged, shaped, and changed nearly everything around us as we grapple with our new normal has become. Our communities across the state, country, and the world gain access to vaccines against the virus. Many of us are turning our attention to what's next. The world is much different than it was a year ago. The Commission wanted to take this opportunity to examine what has not changed during this time, and that is our commitment, along with our fellow agencies, to uplift communities, educate constituents, and empower populations by protecting your human rights. While that goal is unwavering, we can certainly acknowledge the fact that our approach has had to change in some important ways, and for some, that necessary change has resulted in innovation that impacts positively the ways that we serve Louisianians. We are excited to talk a bit more about that with you as part of this virtual conference. We are delighted to welcome voices from three agencies in our state who share our commitment to advancing human rights no matter the circumstance as we collectively look ahead to what's next. From our partners at the EEOC, you'll hear about expected trends in case volume, and we hope you'll understand the digital process from filing a charge of discrimination. From the Children's Cabinet, you'll hear a glimpse of how they are able to revolutionize their approach to training during the pandemic and tackle human trafficking. And from the Office of Women's Policy, you'll learn more about the technology during the pandemic has connected more people than ever for meetings to share critical information. This is all a part of our next normal, and the Commission is honored to navigate this space with each of you. We present this virtual conference as the first of our digital resources to better equip communities like yours with access and opportunities for engagement. We hope you enjoy these conversations and look forward to meeting with you now in the next new normal.
Hello, my name is Marvis Hicks, and I'm Outreach and Education Coordinator for the U.S. Equal Employment Opportunity Commission. What does the Commission do? The Commission investigates, mediates, litigates, and educates the public regarding the employment discrimination laws that the EEOC has authority over. Those laws are Title VII of the Civil Rights Act of 1964, the Age Discrimination in Employment Act, the Americans with Disabilities Act, the Equal Pay Act, as well as the Genetic Information and Non-Discrimination Act. EEOC was created over 50 years ago as part of the Civil Rights Act of 1964, enforcing federal laws against employment discrimination. Our vision is justice and equality in the workplace. The mission is to stop and remedy unlawful employment discrimination wherever it is found. Human faces to our cases are farm workers, women, night janitors, immigrant workers with limited English skills and a distrust of government, African Americans, construction workers facing racist graffiti, Muslims, teenagers, deaf applicants, qualified enough to get a callback, but rejected. Our agency services every employee in the nation under our employment discrimination laws who are employees or non-employees. And we'll talk about that more momentarily. The employment discrimination charge receipts and for EEOC in 2019, and as you see by this slide, were retaliation, disability, race, sex, age, national origin, color, religion, equal pay, and the Genetic Information and Non-Discrimination Act. Nationwide, in 2019, we received the highest charge receipts under the retaliation basis. Next was disability. Next, you see race and sex. And we don't expect this to change um, in the sense that it will go higher in the next normal. We'll continue to do the same work that we've always done. And we investigate cases on a case by case basis. But we expect that the numbers will either remain the same or the numbers will increase in the new normal. Employment discrimination. Who is protected? Employees. We've already talked about that. All employees who are covered under one of our statutes based on race, sex, national origin, religion, the ADA, a known physical or mental disability, the Age Discrimination Employment Act based upon a person's age 40 and above, um, the Genetic Information and Non-Discrimination Act, acquisition of unlawful medical information used against an employee. Temporary workers, applicants, former employees, and undocumented workers are also covered. Who is covered as far as the employer is concerned? Private companies, state or local government agencies, private and public schools and universities, non-profit corporations, employment agencies, labor organizations, joint apprenticeship committees. Employment discrimination deadlines. A employee or a person who files a charge of discrimination must file a charge of discrimination with the EEOC or state agency before going to court. For the state agency, it's 180 days. For the EEOC, it's 300 days to file the charge of discrimination. So let's take a look at our process. And now a charging party does not have to come into our office to file a charge of discrimination. The charge processing procedure is digital. So a charging party can begin the process, or an employee can begin the process by going to eeoc.gov. And on that website, there is a section on how to file a charge of discrimination through our digital processing system. A charge of discrimination is drafted. The employer is notified that a charge of discrimination is drafted. The charge is either investigated or goes to our mediation process. If the charge goes to mediation, the process stops until after the case is mediated. If the case is mediated successfully, that's the end of the process. If the charge is not mediated successfully, then it's investigated by one of our neutral investigators. Neutral in the sense that the investigator does not represent the charging party or the employer. They're only trying to get to the facts of the case. And I should also make mention here that the mediator is also neutral in the process of mediation. If the case goes through the investigative process, then a finding is made. Either there is a violation or there is no violation. If there is a violation of the statute, then the case goes through what we call the conciliation process. And this is the process where the charging party, the claimant, is made reasonably whole. If the case is not successful during the conciliation process, then the case is litigated by one of our attorneys at EEOC. However, if the case, after the investigator makes the finding, is not cause, then the charging party has an option of going through private suit. So the charging party would receive a dismissal notice of right to sue to go to court through their attorney. And in our next new normal, as it has always been, our services are free. If you have any further questions, you can contact me, marvis.hicks@eeoc.gov. Have a great day.
Welcome to the Louisiana Commission on Human Rights, the Next Normal conference event. I'm so elated to be a part of this event and just to share a little bit about what we've been doing on a statewide level to address this issue known as human, sex, and labor trafficking during such a time as the COVID-19 pandemic. Here in Louisiana, we've been very fortunate to have just amazing leadership in our governor, John Bell Edwards, and his wife, First Lady Donna Edwards, who have really taken the lead and taken the helm in moving this state forward and addressing human sex trafficking. We started years ago really looking at what we can do as a state to really inform people that one, human trafficking is very real. The governor mentioned in our first statewide symposium, which was held in September of 2017, he shared a very touching and compelling story of how there was a case of human trafficking right in their own community. And since that time, and even prior to that, he and his wife, First Lady Donna, they have just been just leading the charge of what can we do as a state to address this issue. And we were very fortunate after that symposium, which the Commission on Human Rights and several other state agencies were a part of, just such an historic event for our state. Since that time, we were able to receive funding from the National Criminal Justice Training Center to host a series of regional summits across the state to really take a deep dive and do a comprehensive analysis of what do we know in our state, what's working well to address human trafficking, what are some of the soft spots or gaps that we need to really beef up and hone in on in our state. So we use that funding to travel the state, to go to the specific regions, and to bring key stakeholders together to do that comprehensive needs assessment across the state with more than 739 participants in such a short period of time. It was over a 6-month time period. In such a short period of time, we were able to learn that across the board, stakeholders were telling us we need more knowledge and more information on how to identify victims of human trafficking. Are there any assessments that we can use? How do we know if we're dealing with someone who's in prostitution, or if we're dealing with someone who's engaging in criminal activity, or if we actually have a victim of human trafficking? And so that was one of the resounding pieces of feedback that we got as we traveled the state. So we used that information and other compelling pieces of information that we heard included with, look, we need dedicated staff to address this issue. We are interested in looking more into it, but across the state, we knew that agencies did not have capacity to train someone, to get them educated and informed of this issue known as human trafficking. And so we knew that, and across the state, there's a best practice to hire regional navigators or regional specialists, folks who can become dedicated staff to look into these issues and these causes and to work across systems to address this issue. And so as God would have it, when we finished those summits in March of 2018, the U.S. Department of Justice released a funding opportunity to allow states to apply for funding to improve outcomes of human trafficking among juvenile or child and youth victims. So Louisiana, we applied for that funding, and we were the only state in the country to receive that federal award, a $1.2 million grant to address the issue of human sex and labor trafficking among child and youth victims. And so the Louisiana Child and Youth Trafficking Collaborative is that project. It's a statewide initiative to address human sex trafficking among child and youth juveniles. Our program includes hiring and training 9 key program staff, which we call regional coordinators, who are hired across the state, 1 per region. In some cases, we now have 2 in one region, but we have hired them and we have trained them to do train the trainers. So these specialists, they go out into the communities, they work with key agency personnel, they work with community service providers, and they are the experts in their community to work with law enforcement, hospital staff, first responders, educators, you name it, to get them on board with what is this phenomenon that we call human sex trafficking? What are we seeing in our hospitals? What are we seeing in our schools? How do we know if we have a victim or if someone is in grave danger of becoming a victim of human sex trafficking or labor trafficking? And so we've hired these regional specialists. They've been in place since January of 2020, and they're doing a phenomenal job going through the state, doing trainings. We've also worked and partnered with the West Coast Children's Clinic out of California. They have a best practice tool to assess whether or not someone's at risk of being a victim or whether or not they're actually a victim of human trafficking. So we have used our funding to train service providers across the state on how to use this best practice tool. In just a short period of time, we were able to train over 150 providers on how to use this best practice tool, which some states like Texas have implemented this best practice screening tool statewide. And so this tool, known as, we call it See It, but it's the Child sexual exploitation identification tool is what we're using. And again, we've trained CAC providers on how to use this tool, forensic interviewers. We've trained we're about to train OJJ providers. We're working with DCFS to give them the opportunity to see if it's something they would want to use. We have trained FINS providers. FINS deal with very high risk individuals, children and youth who are delinquent, who are at risk for being delinquent. So we've trained our FINS providers statewide, and we've also started training detention center providers as well, staff in detention centers. So we are pounding the pavement, and we're going across the state to really introduce this tool and to allow providers to at least have some objective instrument to use to really look to see, am I dealing with someone who could be a victim of human sex trafficking? And then lastly, we're implementing across the state. We're working very closely with DCFS, Department of Children and Family Services, to implement human trafficking specific MDTs across the state. MDTs is a best practice approach used all across the country to really not just identify victims, but they come into a meeting, and key stakeholders gather together. They convene once a month, once a quarter. It's different in different regions or in different states how it's implemented. But the MDT is a multidisciplinary team approach to really staff cases, to sit down across like a roundtable approach to talk about, what are we seeing here? Here's someone that presents like a victim. They look like a victim, or we've already confirmed that they're a victim. Now, what does this individual need? What does this child need so that they can move to a place of healing and safety? So we know the trauma that victims of human trafficking experience. And so we want to implement these MDTs, these multidisciplinary teams across the state, so that in each region of the state, when a victim is identified, their case can be staffed and discussed so that any referral or resource that's needed can be put in place so that this victim can have a wraparound approach and get every service that is needed for them. When we talk about victims of human trafficking, we cannot fathom the trauma and the depth of healing that is needed to get them to a place of trusting people again, to get them to a place of not being in fear and torment, to get them to a place of being able to provide for themselves, to get to a place where they can even have stable and gainful employment. All of those things are very important to get them to a place to where they don't want to go back to the perpetrator or the pimp who was selling them, who was using their bodies, who was abusing and beating them. You would be surprised to see and to sit with a victim who know that they should not be in that situation, who wanted to get out of that situation, but when they try to get housing and they're turned down from housing, when they try to get a job and they have some of the criminal activity on their records, how they really are then tempted to then go back into that situation where they were in harm's way, where a pimp or a perpetrator was coercing them, beating them, using all type of psychological manipulation to provide for their needs, giving them only the bare minimum. But to them, it's sometimes they think, well, I had the bare minimum, so I'll go back. They don't know what it's like to live on their own. They're used to that control. And so the multidisciplinary team meetings are used to see what's needed to get this victim back to a place of healing, trust, and restoration so that they can be functional in society. So that's an overview, just a very brief overview of the Louisiana Child and Youth Trafficking Collaborative. we've been so fortunate again to have the governor and first lady just on board at every step of the way with this project. First Lady Donna Edwards has had global summits, summits with Texas, where we've been able to talk about this project. We've invited the U.S. Department of Justice elected officials to learn about this project. And all across Louisiana, starting to get national attention about this project that, look, this model that we're putting in place is starting to work, it's starting to help victims. And the last thing I'll say is one of our regional coordinators in an area in the state did a training with law enforcement. And this was 2 weeks ago or a week or so ago. And once they finished this training, law enforcement, they were like, wow, thank you for sharing this information. Well, a few days later, they came in contact with a victim of human trafficking. And instead of arresting them for criminal activity, they were able to dig a little deeper and they realized that this indeed was a victim of human trafficking and not just a prostitute, not just someone with a felony, but indeed this was a victim of human trafficking. They reached back out to that regional specialist and said, thank you for sharing that information in this training. We needed to know this. Had we not had that training, it's possible that we would have arrested this person and treated them like a criminal. So this information of this notion of training professionals, helping them to know what's the difference between someone that's engaging in criminal activity and having someone that's truly in a situation of harm's way and that's truly being forced to do criminal activity against their will. It's happening, and we have to get folks trained, providers and specialists in the community and in our agencies trained to recognize what human sex and labor trafficking is. So I just want to thank you all for giving us an opportunity to share a little bit about what we're doing here in the state. We're excited. We have a bill coming forth this legislative session, which will create an Office of Human Trafficking Prevention within the governor's office. We are hopeful that legislators will, on both sides, will put their arms and support around this bill so that we can continue the great work that we've been doing here in Louisiana. Actually, in January of 2020, we had just hired all of our regional specialists. We had our kickoff event, which was amazing. We laid out the training and started to get them fully armed and equipped with what their role would be statewide. And 2 months later, after they submitted to us their strategic plan on how they would go about starting to get the trainings done and the See It tool and the statewide the statewide training and information disseminated in communities. A week after they submitted their plans to us, we learned of COVID and things were, the state was shut down. And so we were like, oh no. But as we do it in Louisiana and as folks had to do it across the country, we regrouped, we reconvened, and we found out how to do things in a more efficient way. And so our regional specialists and our project staff across the state, we just started to do things differently. And it actually worked out for good. As everybody shifted to virtual meetings, we were able to have more meetings. So the See It trainings for our screening tool, we were going to have 2 trainings. We could only afford to have 2 trainings because it was so costly to bring in the experts to train everyone, and we would have only been able to accommodate 50 providers per training. Well, we were able to do those same trainings virtually, save costs, and because we were able to save costs, didn't have to pay for travel and lodging and all of that, we were able to do 5 trainings virtually. So that's just one example of how we were able to do things better and in a more efficient way and come out with the same results. So we would not have been able to get 150 folks trained had we not moved to virtual trainings. So our regional specialists, they've continued to pound the pavement and do things virtually. Now that folks are getting vaccinated, we're making plans to shift back to in-person meetings. But while the state was shut down, we just continued to move strategically and get the good work done for the citizens of our state. And one of the things we knew when COVID hit was that more children would be in harm's way. So when children were not in schools, when they were at home more, we know that kids had more exposure to sexual predators and to be harmed, more opportunities to be harmed. And also, we know that children, as they move to virtual learning, the internet, more access to internet means more access to perpetrators. And so we knew that we had to do more trainings to talk about online safety and what children and families and parents need to be aware of, because kids are recruited for human sex and labor trafficking online. And so we knew that we could not stop. It was, we had to, we knew that we had to pump the brakes and do more because children were in harm's way because of this greater access to the internet. We are continuing to implement best practices and work across systems. So one of the things that COVID has done, it's helped us to get out of our silos and to understand that, you know, in order for us to close the gaps in working with victims, we have to work together. And so I'm seeing more agencies, even here in our state. We're communicating better, we're working better together, and we're leveraging and using resources better. So this, as we move forward, we want to keep this communication up. We want to keep this collaborative effort up because it's proving to be more beneficial to victims.
Hi, everybody. I'm delighted to be with you today to talk about our work in the Office on Women's Policy. So I'm Amanda Brunson, Director of the Office on Women's Policy, which is housed within the Governor's Office. Our duties are listed in statute, and it really amounts to a lot of kind of keeping a pulse on the issues that impact women in this state. But beyond that, it's about looking at trends, looking at solutions to the problem. And so, you know, as 51% of the population in this state, it's a pretty big work area, and we know that Louisiana women certainly face a lot of challenges. But the work is really exciting because it takes us as the Office on Women's Policy into partnership with a lot of organizations all around the state, with other state departments, with nonprofits, with universities, with other women's groups, volunteer and otherwise, all around the state. So as part of that work of kind of trying to keep a pulse on the issues that impact women and their potential solutions, we also manage two commissions. We staff the Louisiana Women's Policy and Research Commission, and then we also staff the Domestic Violence Prevention Commission. And so both of those groups really allow us to pull in experts in the field of intimate partner violence, but then beyond that in gender studies and law and health and public health, you know, this wide range of experts who come into our fold and really help study these issues. And so I'm lucky that we get to work with this really powerful group of women from across the state. So part of that work has pivoted a little bit with the pandemic. As you know, we can't really meet in person. And so it's been nice, honestly, to be able to conduct our commission meetings by Zoom. We have, like I said, representation from all across the state. really diverse geographic representation in both of those groups. And it's really a challenge for people to get here to the Capitol 4 times a year. So we've loved that. We've actually had better participation in our commission meetings by allowing people to Zoom in. And we also invite public participation into those, both of those meetings, both of those bodies. They're open meetings, they're public meetings. And so that's been really great as well, to see people who maybe are just interested in those topics and they're not comfortable, you know, driving to the Capitol, coming to sit in the governor's press room, things like that, but they can Zoom in, don't even have to put their camera on if they don't want to, and listen in and participate in those meetings. So that's something that I hope sticks around, honestly, after the pandemic. We certainly want to allow for people to participate in person, but, you know, we have people like judges who have full dockets, and it's really difficult for them to, you know, take the day off of work, block their schedule, drive from North Louisiana down to Baton Rouge, participate in a 2-hour meeting, and then drive back. And so our participation for folks like that was really kind of low sometimes. And so this is nice that they can participate by just blocking 2 hours on their schedule and chiming in that way. So, you know, parking is not fun at the Capitol either. So there's a lot of reasons that I hope that virtual participation in public meetings sticks around, because, you know, it's nice to be able to count something positive out of this pandemic for sure. We know that there has been disparate impact on people of color with the pandemic, and also women, and especially women of color, have been very, very hard hit in this pandemic. And so it means we have even more work to do. We already struggled as a state. We have so many issues. I'll share. This is the Status of Women report that the Women's Commission came out with in 2020, that we can make sure everybody gets a copy of that. That identifies about 10 or 12 of the top issues that are impacting women. There are things like economic stability, sexual assault and violence against women, reproductive health care, birth outcomes, substance use and abuse, mental health. So most of these things have become more problematic in the pandemic and have been harder for people to access services. So, you know, the work that we have ahead of us is intense, but I feel like we have a really good plan for how we can move the needle on some of these things. So one way that the Women's Commission has pivoted a little bit during the pandemic is they were all set to do a listening tour around the state. We really want to hear from women all around the state about what issues are important to them. A lot of the issues that are contained in this report, we know are important. We have data to back that up. But they really are coming from advocates, and many of those advocates are very connected to women on the ground. And so they are an important piece of this puzzle in making sure that we are really keeping a pulse on the things that matter the most to people. But I think what we've struggled to do is to really hear from everyday women who are not very connected to advocates, who are not necessarily part of women's groups or not necessarily plugged into government. And so this listening tour was something that we set out to do around the state, to be able to really hear from people about what's important to them and what's impacting not only them as a woman, but also other women in their lives. So we got about 3 of those sessions out the gate, and then the pandemic hit. So we had to cancel all the rest of those. So we really do look forward to getting those back on the calendar. It's funny, the day that the state and world kind of shut down is the day that our online survey was supposed to go live, which was going to ask all of these same questions so that people who couldn't get to an in-person listening tour event would at least be able to participate electronically. So we put that on hold. We know that needs are very different now, and probably will be for a long time, but we'll hold that survey and do that again when things are a little more back to normal. So in the meantime, the commission shifted from, you know, pulling that input from the community into doing more educational events. So the work of the Status of Women report, like I said, it's about 12 different issues. It's kind of divided into 5 different buckets of work. So one is economic stability, one is caring for children and families, one is safety, one is health, and then the other is substance use and abuse and criminal justice. So we've taken all of the content of the report and divided it into 5 different webinars so that we've been able to help educate people around the state of really the state of the state in these issues, and then also what the Women's Commission thinks can be done to address each one of these. So those have been really exciting. We've had 2 of those so far, and I think the recordings are available on YouTube and available through the governor's office website. We've had the session on economic stability, and we've also had the session on caring for children. So the rest of those sessions will come soon. They're free and they're open to the public. We've had a dynamic set of speakers who presented on all of the topics, and then we have a full Q&A for anybody who wishes to attend. So I really encourage people to do those, because we want to hear, you know, we can't get out, we can't meet with people, but we want to hear about their ideas for how we can really, again, move the needle on some of these things that we've worked really, really hard for in all of the years, but maybe haven't seen as much traction as we could. So as part of all of that kind of digital outreach that's come about since the pandemic, we are really trying to expand our email list so that we make sure everybody's fully informed, not only of the work of the Office on Women's Policy, but also those two commissions, the Women's Commission, Women's Policy and Research Commission, and Domestic Violence Prevention Commission, and then anything else that we think is important and needs to get into the hands of the people around the state. So, so please, if you are not receiving those emails, we would love to hear from you. And I can share my email address and make sure that participants can get that as well. And then as far as the Domestic Violence Prevention Commission, one of the ways that they have pivoted in the pandemic, one of the core subcommittees of that group is about training, providing training to law enforcement agencies. And so previously we had 2 members of that commission who would really travel around the state to offer those trainings to law enforcement entities. They've had to shift and figure out, how can we do some of that stuff by Zoom? How can we do some, you know, pre-recorded trainings that people can watch at their leisure? And then really taking a focus on legislation. So I want to talk a little bit about legislation that is disproportionately impacting women in the state, this session. So there's a couple of pieces of legislation that I want to point out. We're very fortunate that the governor's legislative agenda contains a lot of bills that would be beneficial to women. So one is on workplace accommodations for pregnant women, and that is going to be Senate Bill 215 by Senator Regina Barrow. And this is something that has passed unanimously, or at least with bipartisan support, in many states around the country, including some southern states. So in our existing law, pregnant women in Louisiana cannot be discriminated against for their pregnancy and employment. And they also are supposed to be afforded a job transfer if their position is too strenuous and there is another position that they're qualified for that's available. So as you can imagine, that's a pretty small window, you know, of opportunity for women. And so what this legislation would do would require reasonable accommodations for women if they need them in pregnancy and in the postpartum period, for example, for breastfeeding or to attend follow-up medical appointments. So reasonable accommodations are generally something that are very low cost or even no cost. It may be that a cashier needs a stool to sit on. It may be that a retail worker needs to be able to carry a water bottle on the floor. It may be that you need just a few extra bathroom breaks during the day. So we want to make sure that women are afforded these types of opportunities so that they can stay connected to a job. They may not want a job transfer. They may love their job and want to be able to do it, but do it safely. And then also we know that there's research that accommodations like this support healthier pregnancies, which mean healthier moms and healthier babies. Another piece of legislation that I think is important for women is about pay transparency and salary history. So we tend to call this the Equal Pay Bill. Equal pay is something that's been important to the governor for a long time since he was a legislator. And in Louisiana, we rank 49th across all of the country and including Washington, D.C. for our wage gap. So Louisiana women make 72 cents on the dollar to what Louisiana men make. And that number is even worse when you break it down by race. African-American women make 49 cents on the dollar and Latina women make 53 cents on the dollar. So we have a long way to go in making sure that wages are equitable in this state. But there's a lot of ways that we can get there. And there are things that women can do. There are things that employers can do. There are things that the legislature can do. And the legislature is really uniquely positioned to do this work because they can implement policy that impacts all the businesses in the state, or at least a wider swath of the businesses in the state, than requiring every individual employer to make some of these changes on their own. And so this particular legislation is House Bill 245, by Representative Barbara Carpenter. It's actually good for all workers. It's not just good for women, but it allows workers to be able to talk about their wages with other employees without fear of retaliation. And sometimes that is in an employee handbook, it's written down. Sometimes it's just implied that it's not okay for workers to do. But when people say, well, women should just negotiate for more money, how can you do that if you don't even know what your coworkers are making? So this would allow for people to talk about their wages if they choose to do so. And then the other important piece of this is banning the use of salary history. So research tells us that women who start behind often stay behind throughout their career. So that even leads to less money in retirement to be able to live on because they've made less all throughout their career. And that cycle is perpetuated by starting in being paid less than you should be paid. And so this would make it where employers cannot ask about salary history or make employment decisions based on salary history. So women are able to really secure a job that pays what it should pay based on the work, what it should pay based on the region, on qualifications, all of those things, rather than what she made at her last job. So the governor's agenda also has several bills related to sexual harassment, to Title IX, to human trafficking. Truly, it is an agenda that is really supportive of women, and we look forward to doing this work and invite all the advocates who want to be a part of this to please contact us, come along with the Office on Women's Policy. There's a lot of ways that we can change the landscape for women in this state. And quite honestly, a lot of it begins with supportive workplace policies.